Good afternoon, everybody. Christine Barconi here in the NBC4i Streaming Center. Thank you so much for joining me this afternoon. Also joining me right now is Dr. Joseph Gastaldo from Ohio Health, infectious disease expert. We want to talk about booster shots. So we're going to do a live Q&A about booster shots. We asked you for questions earlier, and we've gotten some excellent questions from everybody. Dr. Gastaldo, I don't know if you saw on social media. I got a full list of them, but for those of you who are watching live with us right now, if you have any additional questions about COVID booster shots, leave them in the comments because I'm going to be monitoring them. Thank you for joining us, Dr. Gastaldo. I do want to start with one opening question because we just got some breaking news, some numbers in, and Ben Orner, our data guy, he told me that today was the first time in 75 days since July 9th in Ohio that the 21-day average for cases went down. That's obviously 75 days on an upward incline is not the best in the world, but what is your reaction to it finally going down, at least for one day?
Yeah, that actually fits in well with what's happening nationally. So if you look at where we are currently in Ohio in our Delta surge, things are kind of peaking out a little bit. You know, the Delta surge began in the Arkansas, Missouri area. It should surprise nobody. The Delta surge began more or less in areas with lower vaccination rates. So in those states specifically, their numbers have come down. Now, their downward slope is not as steep as the upward slope. And I think we're kind of there in the state of Ohio, too. So that's positive news. We'll have to see where things go over the next couple of days.
All right, let's bring our focus back to these COVID booster shots. I want to start here with what is with all the back and forth? I think it's a little bit confusing to people. You know, the president came out and said, let's all get booster shots. But then the FDA, I believe it was, came out and said something different this past week. Can you clarify for us who is getting booster shots, who is not getting booster shots? What's the status?
Let's talk about all that. So the first thing I want to say with COVID, anything related to COVID, there are no absolutes, and anything related to COVID is full of caveats, whether it be testing, whether it be treatments, whether it be PPE use, whether it be vaccines, and now immunology. There are no such thing as caveats. And I think when we talk about third doses, it's important to really call out and say, from a global health perspective, from a public health perspective, it's still much more important to get vaccines into people who have not yet been vaccinated. In addition, with all this discussion about third doses, what people want to hear is that the vaccines do not work because we're talking about third doses. That's not true whatsoever. Our vaccines are working extraordinarily well with what matters the most, preventing people from having severe disease, keeping people out of the hospital. So before that, let's talk about immunology. I'm going to give everybody a basic science lesson on immunology and what type of immunity you get after somebody is fully vaccinated. When somebody gets a COVID-19 vaccine, after they're fully vaccinated, there's two parts of their immune system that are stimulated. The first part are your antibody levels. Antibodies are floating around your blood, and antibodies are what prevent against infection. So after you're vaccinated, you have high antibody numbers, and over time, all antibody levels come down. That's how antibodies perform. You don't have high antibody levels all the time. Naturally, they come down. Antibodies protect against infection. So you have a virus there in your nose, antibodies bind it, they neutralize it, and the virus does not cause any disease. The second part of your immune system that's stimulated after you are vaccinated are your memory cells, specifically B and T memory cells. Guess what? Those memory cells last for years, decades, and for younger people, maybe the rest of your life. Memory cells are what prevent people from having severe disease, like hospitalizations. So I'll use myself as an example. I was vaccinated in December of 2020. I had great antibody levels, and naturally over time they come down. And because I have lower antibody levels, I am at risk for a post-vaccination or breakthrough infection. But guess what? My memory cells are ready to go. They're in my bone marrow. If I do get a breakthrough infection, the virus will be recognized, my antibody levels will be topped off, I'll clear the virus a lot quicker. And it's very, very unlikely that I'm going to have severe disease. So if I do get a breakthrough infection, I'm expected to either have asymptomatic infection or cold or flu symptoms. And that's the whole discussion about third doses. Not everybody is going to need a third dose. For some people should receive a third dose, and we can kind of talk about that.
Okay. So we've got some really good questions here, and I think we should get into it. Who has already, if anybody, have gotten booster shots?
Yeah, so right now, as at the time as I speak, right now, the only people who are authorized to get a third dose and recommended to get a third dose are those who are with a weakened immune system, those who are moderately or severely immunocompromised. That's only 2.7%, or roughly 7 million people of the American population. Right now, if you fall into that category, you can go get your third dose with an mRNA vaccine. Right now, at this point in time, there is no recommendation for additional Johnson & Johnson doses for anybody who has previously received that. Guess what? Johnson & Johnson already announced yesterday through a press release that they are working on additional dose recommendations. So stay tuned for that.
Okay. All right. And so we have a lot of people who are roughly around 64, 65 asking, are they going to be eligible for a booster shot? Because that 6-month mark that has been tossed around there is coming up, if not is already here for them if they, received the Pfizer shot right away whenever they were eligible.
Yeah, so let's reflect a little bit on how vaccines get authorized and how they get recommended.
Yes.
So the way we review vaccines in our country is the gold standard of the world. No other government, no other country does it the way we do. And the way we do it is completely transparent. So last Friday, September 17th, a subcommittee within the FDA reviewed information on authorization for additional doses. What they looked at was information from the country of Israel, and they also looked at safety data submitted by Pfizer from only 300 people who received a third dose. So they had 2 votes last Friday at the FDA. Vote number 1 was to authorize an additional dose for anybody above the age of 16 who is 6 months out from having their second dose. Guess what? Unanimously, that was voted no. That was voted no. And the big reason why it was voted no was because the process is working. They were doing what they're supposed to be doing. They were asking for safety information specifically for younger people. And when it comes to the third dose, the only safety information on the third dose was about 300 people and also observational data from the country of Israel. Basically boils down to this. Third doses for older people is very, very safe. And for most people, it's going to be very, very safe. But one thing that we didn't really have clarity on was the potential for any type of adverse reactions for younger people. Specifically, when you look at myocarditis, we know that that is, first of all, a very, very rare adverse reaction associated mostly with second dose mRNA vaccines in younger people, men more than women. But when they've gotten it, it's been mild myocarditis. But the FDA, on purpose and intentionally, they want safety information. So for that reason, they did not make a general authorization for doses for everybody. So Dr. Marks, the leader of the FDA, was on there, and there was all this chatter, and they took a 10-minute break. After the 10-minute break, they got together and they said, you know what, let's talk about something we can agree to vote on to do an FDA authorization for third doses. So what they voted on, the first one's pretty clear cut. If somebody is 65 or older and they are at least 6 months out from their second dose, that vote passed. In addition, they also voted to authorize a third dose for anybody at risk of severe COVID-19. And included in that are people who have jobs who may have higher exposure to the virus. So the first, that passed. The first thing is pretty obvious, 65 and above. The second bucket is very, very vague and quite frankly, subject to interpretation. So today and tomorrow, the more granular details of the vaccine recommendations are expected to come out by the CDC. The CDC is meeting today. I've listened into a lot of that conversation. And then by the end of the afternoon tomorrow, there'll be more granular details on who qualifies to get a third dose of a vaccine. Now, when you go get a third dose, first of all, what we're talking about now is with Pfizer only. Those Moderna recipients need to wait for October for third dose access to Moderna, because the way the third dose is going to be now, they want you to stick with the same manufacturer because that's how it's being reviewed at the level of the FDA and the CDC. So when third doses are given, it's based on the honor system. So for those people who are immunocompromised now, you don't need a doctor's order. You don't need to have a prescription or anything there really to prove that you are immunocompromised. It's based on the honor system. It's always been that way, and it's very likely to be that way too when final third dose authorization or recommendations come out for Pfizer.
Okay. So you kind of answered the next question that a lot of people had about mixing their doses. So people, with that got the Moderna vaccine that are 65 and older are saying, hey, if I do want a booster, could I get the Pfizer vaccine?
Yeah, so mix and match studies have been done, specifically in Europe, and it's probably safe, it's very safe, but the way the FDA and the CDC are reviewing data submitted to them, the only thing being submitted to them are boosters with the same vaccine that people receive. So initially, I doubt very seriously there's going to be an authorization or a recommendation for people to mix and match. And when you go to get your vaccine, whoever's giving you the vaccine has to stay within the constraints of its authorization and recommendation.
Okay. Dr. Castaldo, so you had mentioned the very slim chance of the myocarditis. Did I say that correctly? Is that another reason? Because I know there are a lot of people who aren't 65 and older who, kind of getting antsy, chomping at the bit, my efficacy is wearing off, just like you said with the antibodies. Is there what's the best reason that they should abide by the honor system and not get that third shot because it's not recommended?
Yeah, so really though, when you look at people who are at risk for severe COVID-19, that's a very all-inclusive term. It's anybody who's overweight, anybody who has high blood pressure, anybody who's diabetic, anybody who has heart disease, anybody who has lung disease. All of those conditions put people at high risk of severe COVID-19. So again, I feel confident in saying that once we get more granular details from the CDC, those people who should get a third dose will be included in the recommendation. We just have to wait and see. And I feel confident that that'll be the case. The CDC did that when the same question came up when we said, well, what is severely or moderately immunocompromised? Those granular details are actually defined. And I do expect that to be the same way too for those at severe risk of COVID-19.
Okay, some questions. So David wanted to know, will booster shots actually keep people from getting COVID?
Booster shots, so basically what the booster shots do is this. They top off your antibody levels. They top off your antibody levels. And like I said earlier on, higher antibodies prevent you from getting infection. Now, we don't know with certainty that getting a third dose is going to do anything for those memory cell stimulation. Young, healthy people, I doubt getting a third dose is going to stimulate those memory cells more. But older people, yes. Vaccines don't work as well in older people. We've known that for years. Flu shot and a pneumonia shot, any type of vaccine, they don't work as well in older people. So it's pretty much a non-controversial thing for those 65 and above to get a third dose.
Okay. Will booster shots keep people from having to wear masks is another question.
Yes, they will. So let's dissect that a little bit. The CDC recommendation now on wearing a mask, regardless if you've been vaccinated or not, is based on levels of community transmission. So in the state of Ohio, we have high levels of community transmission. So I'm going to give you an analogy. We're going to use the rain jacket as an analogy. We wear rain jackets to stay dry when it's raining. And think of the rain jacket of your immune response that you get after you're vaccinated. So if you're outside and it's only sprinkling, with low levels of community transmission of COVID, the rain jacket's going to keep you dry if it's sprinkling. But if it's downpouring rain, if you're in the middle of a hurricane or a heavy thunderstorm, and that's where we are now with high levels of community transmission. The rain jacket, you're going to get wet some. You're going to get wet some. And when it's sprinkling, when there's lower levels of community transmission, the guidance from the CDC is that fully vaccinated people can safely not wear a mask, but we're not in that category yet today. We will get there. We will get there, but we're not in that category now.
What's the best way to get there?
The best way to get there is to get immunity. There are two ways to get immunity. And actually, the pathway to ending this pandemic is through immunity. There are two ways to get immunity. The first way is the safest way, and it's the stronger way, and that's to get vaccinated. Yes, it is true. If you get COVID, you have a degree of immunity. However, that degree of immunity you get after getting COVID is quite variable from person to person. And more importantly, there's no way to measure it. Antibody levels are not meant to be used as a marker of immunity. The antibody levels are not FDA approved. They're FDA authorized on emergency use. They're not standardized. I can tell you I've had patients get antibodies done at different labs. One lab says it's detectable. The other lab says it's not detectable. And the FDA clearly gives guidance on this. Antibodies are not meant to be used as a marker of immunity. There are many infections, syphilis, HIV, hepatitis C. You get great antibodies from those with infection, and those antibodies don't do anything.
All right, another question. For those who are fortunate enough to have sick days available to them, PTO, etc., with the third shot, with the booster shot, if they are going to receive it, should they schedule a day off in advance? Are the same reactions being reported from the third shot as were in several cases of the first and the second shots?
Yeah, that's a great question. So what Pfizer did present was vaccine side effects from 300 people who received them. And when you look at the vaccine side effects, it's essentially identical to the Pfizer study and those who received the second dose. So what I would tell people is basically this. Based on that, the reaction you would get from a third dose would essentially be very, very similar to what you had with the second dose. So if you did pretty good with the second dose, chances are you'll do fine with the third dose. If the second dose, like for me, when I got the second dose, I had man flu for about a day.
I did too.
And I would expect that to be the same thing for me too. But I can tell you, my mom and dad are in their early 80s. They had no problem with either of their two doses.
Yeah.
So again, that's a reflection that elderly people, the older you get, vaccines don't work as well, and your immune response is not as robust.
It's a little disheartening. I know. I knew that, but same situation with my mom. She didn't have adverse side effects that I did, and I never even thought of it like that. I don't like thinking about that. All right. So, question from John, a little bit specific, but I think we can get into it. My wife is 78. She has asthma and AFib. Can she get her booster? She took Moderna in March.
Yeah, so she should get her booster when the Moderna third dose is officially authorized and recommended. So what we're talking about right now is only third doses with Pfizer. However, remember back in the day, back in December, Pfizer always went first. A couple weeks later was Moderna. The exact same thing is happening when it comes to third doses. So we are expecting the same thing to happen for third doses with Moderna sometime in October. The recommendation, as I stated earlier, for third doses is to stick with the same vaccine that you first got with the first series.
Okay. I think that was a lot of people's questions, because I feel like people who had got the Moderna, they're like, oh man, I would really like that, especially if they're immune compromised at this time. All right, John.
Well, if you're immunocompromised, you can get a third dose.
Okay, got it. All right, well, I'm glad we made that clear. Thank you very much. Appreciate that. All right, so John is asking, and I think you've touched on this a little bit, but I do want to ask specifically for him because he's asked several times, is exposing ourselves to COVID going to be a better long-term alternative than getting potentially yearly booster shots?
Yeah, so again, that's a little bit a caveat. Let's talk about that a little bit. So the CDC today actually had a discussion about that, really about the immunity you get from natural infection. And basically, they kind of made a summary statement saying that after you are fully vaccinated, again, after somebody is fully vaccinated, if you get a breakthrough infection, immunologically, that acts like a third dose of a vaccine. where you get more stimulation of your memory cells and your antibody titers are topped off again. The whole wild card and the whole discussion is the potential for someday, and I don't see this happening in the near future, but someday with so much infection going on in the world, there may be a variant that evades or escapes the immunity that we have. And again, I don't want anybody to fear variants. We're going to get through the whole Greek alphabet. We've been talking about Delta, there's the Lambda variant, there's the Mu variant. We're going to get through the whole Greek alphabet. We need to respect the variants. We need to study the variants. And if there's a signal out there that the variant is breaking through any type of natural immunity or vaccine-induced immunity, these vaccines can be changed rather quickly and manufactured in a quick way. But so far, that has not been the case at all. The vaccines that we have now are performing very, very well with what they are intended to do. Keep people out of the hospital, keep people from having severe disease.
Okay. For those who are also going to get their flu shot, does there need to be any time between getting your flu shot and a booster shot?
Short answer to that is no. When the COVID vaccines first came out in December of 2020, the CDC was clear. And again, they're very conservative. And they said until there is further information, the recommendation is to separate the COVID-19 vaccine from 14 days from any other vaccine. And that's fine. I was okay with that. But I can tell you as an ID doctor, I'm scratching my head because that's like, you know what? We give vaccines together all the time. We've been doing that for years. The CDC's Vaccine Advisory Committee has rescinded that. And they basically say that you can give a flu shot and a COVID-19 vaccine together. They actually say you can give them in the shoulder at the same time, same shoulder, as long as you separate them by a few centimeters.
Okay. All right. So I think I want to go back and just make it very, very clear about the recommendations that came out last Friday and how that translates into a timeline of potentially people 65 and older getting a third dose.
Yeah. So what was talked about last Friday and what happened last Friday was an FDA meeting of their vaccine subcommittee. Remember, the FDA body is the body that either does the approval or authorization.
Correct.
That's what they did on Friday. They authorized third doses for those 65 and above and for those considered to be at severe risk of COVID-19. And again, that's subject to interpretation. People are asking, oh my gosh, what's that mean? The second part of the review process is the CDC's Vaccine Advisory Committee. They are meeting today and they're meeting tomorrow. They are the ones responsible for leaving the detailed recommendations on who to get the vaccine, what medical conditions, et cetera, how to store it, all those types of things. That's their responsibility. So we're still waiting for that process to happen. That's happening right now for third doses of the Pfizer vaccine. And the same thing is expected to happen sometime in October for third doses of the Moderna vaccine. And then after that, hopefully additional doses for a J&J vaccine.
Okay, so to be clear, 65 and older, yes, we're just waiting on the details of when and how that's going to happen.
That is correct. So stay tuned for that. I expect there to be clarity on that Thursday or Friday.
All right, let's talk to the parents really quickly because Pfizer, I forget the technical term for it. There's just so many steps and processes. They said they're good for 5 to 11-year-olds. And I know a lot of school-aged parents are waiting for that. Can you talk about that and what those steps look like?
So first of all, we want to let everybody know too that Pfizer's vaccine is officially FDA authorized and CDC recommended for everybody 12 and above.
Yes.
And I feel quite safe in telling anybody who's 12 years old or in that category to get vaccinated.
My oldest niece just got hers the other day at Children's. It was the best day of the past 2 years for all of us.
Awesome. Yeah. Congratulations. That's
yeah.
great. And we still have opportunities to get vaccines in that age
yes.
group. So what Pfizer recently released was phase 1, phase 2 information of children who received their vaccines. And the only thing they said in their press release was 2 things. Number 1, the vaccine was well tolerated. Number 2, the vaccine induced a very robust and high antibody level. The other thing they shared was that children who were 5 to 11 in that study received 1/3 the dose of adults. Remember, children are not little adults. Their physiology, their immune system is very different. Their immune system is much more sensitive, more robust. And when it comes to vaccines, oftentimes children get lower doses. So it's 1/3 the dose that adults get. The actual randomized controlled trial that we're all used to, half the people get the vaccine, half the people get the placebo, that's not yet been submitted to the FDA for review. That's what's going to be reviewed once the FDA's vaccine committee gets into the fine granular details of looking at the study. So we don't know what the study results are yet, but tentatively, based on what Pfizer said, just to recap, the vaccine's safe, the vaccine does induce a very nice antibody response in children.
Okay. Dr. Castaldo, anything that you want to touch on that we did not get around to today?
No, we hit on a lot of things, and thanks for having us. And we have to let people know too, again, the vaccines are working well, and it's still more important from a public health perspective to get vaccines into people who have not yet received them. Stay tuned. In a couple of days, we'll have more granular detail for third doses for Pfizer recipients. And if you have any questions, either reach out to your healthcare provider or trusted source of information. But not everybody is going to need a third dose. Specific members of society should receive a third dose.
I know. I think that's a hard pill for a lot of people to swallow. And they're a little bit antsy, but we got to listen to the doctor. So I think that's the most imperative thing is call your doctor, your physician, your GP, and talk to them about the vaccine if you have any questions, and they will answer them factually and with the best information for you because they know you. So Dr. Castaldo, thank you so much. We appreciate it. Guys, I'm going to clip this full interview and put it up on NBC4i.com. We will also have snippets of it in the 4, 5, and 6 o'clock show. Again, thank you, Dr. Castaldo from Ohio Health. We'll see you later, guys. Bye.
Interesting. Bye.